This is Power Lines, the show that pulls back the curtain on how power really works. Your hosts are Robbie and Terry, both 15. Every week they break down who really runs things and how regular people can push back.
Welcome back to Power Lines, the show that pulls back the curtain on how power really works. I'm Terry.
And I'm Robbie, and today we're following the money through the most confusing industry on the planet, healthcare.
We're talking hospitals, insurance, drug companies, and the question everyone's parents ask: why does an aspirin cost $40 in a hospital?
Spoiler, it's not because aspirin got fancy.
So let's start with the big picture. The United States spends about $12,000 per person per year on healthcare.
That's more than any other country on Earth, and we're not even number one in health outcomes.
Switzerland is second and spends like half that. So where is all the money actually going?
Okay, first stop on the money trail. Hospitals, they have something called a charge master.
Which sounds like a superhero, but is basically a secret price list that almost nobody pays in full.
Hospitals charge insurance companies a high price, then negotiate down, and the whole thing is deliberately confusing.
It's like if a pizza place listed every pizza at $100, but your pizza club card got you a deal.
Except the Pizza Club card costs you thousands of dollars a year in premiums.
Right, which brings us to health insurance. Insurance companies take in premiums and pay out claims.
But they also have administrative costs, executives, shareholders, lots of people getting paid before your doctor does.
In most countries, one government program handles insurance. Here, there are hundreds of private companies, all with different rules.
That complexity alone adds massive cost. Doctors' offices need whole teams just to deal with billing paperwork.
Some estimates say about 30 cents of every healthcare dollar in the US goes to administration alone.
30 cents, not medicine, not nurses. Paperwork.
Now let's talk drugs, because this is where it gets spicy.
A drug company invents a medication, gets a patent, and for about 20 years, they're the only one who can sell it.
No competition means they can charge basically whatever they want, and they do.
The same insulin that costs about $300 in America costs about $30 in Canada.
Same drug, different country, different rules about what companies are allowed to charge.
Other countries negotiate prices directly with drug companies. The US mostly doesn't.
Drug companies say they need the profits to fund research into new medicines, and that part is actually true.
But critics point out a lot of that research was funded by the government first, like with taxpayer money.
So sometimes the public pays twice, once to invent the drug and once to buy it at a high price.
There's also a character in this story called a pharmacy benefit manager, or PBM.
They're middlemen who negotiate between drug companies and insurers, and they take a cut without most people knowing they exist.
It's like hiring a translator who also charges you to breathe.
Okay, but why don't doctors just charge less? Here's the thing, doctors in the US pay a lot to become doctors.
Medical school can cost over $200,000, so new doctors start out already owing a small fortune.
That shapes what salaries need to look like just for doctors to survive financially.
And unlike many countries, the US doesn't cap how many doctors can be trained, but the process is slow and expensive.
Less supply of doctors, more demand for care. Basic economics says prices go up.
So to recap, secret price lists, giant admin costs, no drug price negotiation, mysterious middlemen, and expensive doctor training.
It's like the system was designed by someone who wanted it to be confusing.
Nobody exactly designed it. It grew piece by piece over decades, each piece making sense to someone at the time.
That's almost scarier than a villain.
The good news is people are paying attention, laws are slowly changing, and transparency is increasing.
Medicare, the government program for older Americans, recently got new power to negotiate some drug prices directly,
Small step, but real, and understanding how the system works is the first step toward changing it.
which is exactly why we just spent 20 minutes following the money.
Knowledge is free, even if everything else apparently isn't. See you next week on Powerlines.